Hello, I'm Dr. Sangeetha Sharma, the Chief Medical Superintendent of Sanjeevani and CHSS in NFC, Hyderabad. I'm going to tell you in brief the various measures we have taken under CHSS in Nuclear Fuel Complex to mitigate this coronavirus pandemic. We have started early in the month of January 2020 itself, when the news of the corona pandemic was just breaking. We started by educating the people or the patients who visited Sanjeevani for consultations by telling them and making them aware what coronavirus was, how it was spread and how to contain it, what its symptoms were, and how the importance of hand wash, social distancing and wearing the mask was absolutely important in containing the disease. In March 2020, when the lockdown was announced, we at Sanjeevani in the medical services never stopped giving consultations. Helpline numbers were circulated to all the beneficiaries who would contact us on the phone to get consultations for their various ailments. Medicines were advised on the phone. Provisions were made so that the patients could buy these medicines and apply for reimbursement at a later date. This provision was extended till September 2020. For patients who were very old and frail and couldn't either come to Sanjeevani or go out and buy medicines, we also made provisions to supply them medicines at their doorsteps. In June 2020, with the help of CED, two specialized contactless cubicles were constructed to examine patients with fever and influenza-like symptoms. Two such cubicles with HEPA filters and exhausts were constructed in the area adjacent to Sanjeevani. In this way, the doctor could examine the patient and advise medicines with absolutely no contact between the two of them. Investigations which were ordered, the form was given then and there, and the medicines could be collected in the outsourced pharmacy just outside the cubicle. In this way, we have been tackling all the coronavirus positive patients, which are mild and moderate, on an OPD basis by providing them a home quarantine COVID home care kit. Also, daily counseling is done by the nurses for these patients who are positive and who are under home quarantine by giving them the necessary counseling, encouragement, medical advice. In those cases which become a little more severe and serious, these patients are hospitalized in the super specialty hospitals, two of which have been recognized for the special corona pandemic. We have agreed for a special COVID package and entered into an MOU with two specialized super specialty hospitals for this purpose of corona epidemic. Beds are reserved for NFC patients in these hospitals so that the severely affected patients could be admitted there without any problem. Also, a triage area has been constructed just near the gate of Sanjeevani, where a nurse segregates the infected and the non-infected patients and directs them so that the infected patients are registered then and there into the fever OPD, and the non-infected patients who have come for the regular forms or for collecting their regular medicines are registered to the doctors who are sitting in Sanjeevani main block. Medicines and IPOP forms are provided for patients who are seated in the specially constructed waiting areas outside Sanjeevani without any problem of having them to move here and there. Also, for the CKD patients who are highly comorbid, we have given the provision of collecting the forms which are valid for 3 months. Hence, they can undergo seamless maintenance hemodialysis for 3 months without having to repeatedly come for a form every month, and treatment and pharmacy would be also provided along with consultations in these 3 months. Lastly, we are also finalizing the e-Sanjeevani mode of video consultations with the help of computer divisions as directed by the Ministry of Health and the Central Government Health Scheme. This in brief, were the initiatives which were taken by CHSS under NFC. Thank you.